So I wanted to mention what Project 2025's idea is when it comes to their plan of action, which isn't a plan of anything, but for decreasing suicide rates. You know, this is a passionate area for me because I work in mental health. But of course, I'm not at the professional association level because I don't usually stand with them. I don't usually stand with the Project 2025 people because they all say the same bullshit the other ones did, and they don't know how to fix anything. But so they have 73 partner organizations that they're working with. Project 2025, who are the 73 partner organizations? Because you talk about having public-private partnerships. Yeah, can you please just leave the mental health community alone? Please, just stop doing anything because you make it worse. But you all do. Because you look to these experts that do not know what's going on, because the people that do are the people at the bedside. But you will make sure that anybody that controls the healthcare system, anybody that controls mental health, will have some arm into nursing associations, medical associations, and it will be damned from ever getting better. That's why Project 2025 is bullshit. Because one of the 73 partners they're working with, get this, is CDC. The very people that should have never locked people down, that's who they're going to be working with. When really, if we want to help mental health, the best thing would be to do is get rid of the agencies that clearly show they don't know what they're doing. Why do we keep... This baffles me because, you know, whenever you work at a job, no matter what it is, you have to show a level of competence. You have to show a level of that you know what you're doing, that you know, you don't just get to say, oh, I screwed up and we'll try to make it right next time. I mean, how many times does CDC get by with that? Or these people that, you know, head up all these think tank groups. Oh, no, we'll do it different. No, you're saying the same damn shit y'all always said, and you don't know what you're doing. Because, again, you are universities that are tied to that you're so important, and you know so much, and you don't. You don't. So they have this, this initiative to reduce the annual rate of suicide by 20% by 2025. This project focuses on 4 targeted critical areas: healthcare systems, emergency rooms, corrections, and firearms. Firearms? What does that have to do with suicide? We already, the reason I'm saying this is because this is where that overlap comes in to try to toy with firearms. Okay, that's my opinion on that. Do people get hurt by firearms or try to kill? Yes, they do. But many of them try to hang themselves, cut themselves. There's men jump off buildings, jump into rivers, jump in front of cars. Rarely do I have ones that want to kill themselves with a gun. Really, it's more that they want to jump in front of traffic or jump in front of a train. The biggest, the one I see the most when I have somebody that's suicidal and they have a plan, the plan is almost always to OD. Rarely is it, I'm not saying it's never that they want to shoot themselves, but it's more that they will OD. So I don't trust this whole, okay, so in the emergency rooms, it's very simple. We need an area in the emergency room that's a nurse is there that can go to the doctor and we need actual psych nurses in the ER. Like that's what we did at Northwest. Well, Northwestern came in and messed it all up, but at the other, at Northwestern, when I was there, we had a special area that had been created before Northwestern came in and bought it. Well, and it's still there, but that's what you kind of need. You can't just, you know, throw an NP down there and then them come and go. You need to have somebody that is there because people are in the ER for a long time. So, there's just a lot of things you could do with that, but they're going to listen to all these other people that don't know what they're doing. I don't like the 73 partner organizations. So then they go on to say here, recent data from the Harris poll paired with the American First project show that 81% of Americans believe it is more critical to make suicide prevention a priority due to the pandemic. You know the best way you could do that is you need to have some caring people. These people think they care and they don't. So that's why I said not too long ago, I said, we have a lot of people that think that they care, but they really don't. This is what I mean. Because they come up with these plans and and this is how we're going to tackle it, or we're just going to review this area forever, but we're never going to be solution oriented. Like, it shouldn't take forever to get to answers either. That's the other problem. So they say, in addition, 93% of people surveyed indicated that they believe suicide can be prevented. Okay, well, I think most people know that. Okay, did they really have to do a survey on that? Okay. Additionally, 69% of people indicated barriers to discussing suicide with others, including a lack of comfort and knowledge. Well, the best thing you could do in regards to mental health when it comes, because it is uncomfortable for patients to talk about when they're at their most vulnerable states. But then during COVID, most especially, but it was already there in mental health. It just came roaring in at COVID time, is telehealth. Telehealth should not be used. Now, I mean, if it's a home-based kind of thing, you see your doctor. But when it comes to patients in the hospital, doing telehealth is shitty. Like, I'm just putting it straight. It's cruel. It's impersonal. And that's exactly what they want to do with this AI stuff. So this is what I mean. I'm saying some simple things that should be removed from mental health. Telehealth for patients that are in the hospital. They should be allowed the respect of a provider or a nurse looking at them face-to-face in the room. Not through a television. That's not even healthy for people that are psychotic, that believe TVs are talking to them, like that are already struggling with reality. And then you want oh, the doctor's on TV or on a laptop. It's so disrespectful. Then what really just enraged me was then it goes on to say Project 2025 aims to reduce the annual suicide rate by 20% by the year 2025. The initiative is led by AFSP and supported by the CDC. So then I don't support it, which is why I don't support Project 2025. It's also supported by the National Institute of Mental Health, the National Action Alliance for Suicide Prevention, and many others, all of which I'm sure I would disagree with. Now, it may seem like I'm just a really disagreeable person. No, I'm not. I just would like it for the people that really don't help others, that just get awards for coming up with some stupid idea that never changes anything. I would like the people that truly have ideas, that truly want to help and make a difference and aren't looking for awards, not looking for, to be some, on some spotlight. But I would like for them to be the ones that are fixing these problems. And the biggest problem we have is we currently have the CEOs that are running healthcare that should go to jail. That's the other thing Project 2025 doesn't want to address, okay? Like, people that are going to be having hospitals where patients' lives are in their hands, and just because they don't have a professional license, they can't hold them accountable. Well, that's bullshit. They should be held accountable. I mean, the stuff they're doing now, we don't even get nurse to nurse anymore, for nurses that know what that is. Nurses can get orders from a doctor and put orders in under a license. That's part of having a registered license. Now it's non-nurses getting nurse to nurse. And then they just bring the patient to me. Like this, they're going so above it. They're just trying to, they're going to try to just remove nurses altogether as they bring in AI. So it's sad that the Project 2025 transition team can't figure this stuff out. I mean, I'm just an associate degree nurse, but you go keep listening to American Nurses Association and your CDC and Health and Human Services Heritage Foundation and Project 2025, but you sure as shit won't make anything better in America.